Hi, I'm Eric Bonson, and you're watching CCC Trends. It's been more than 3 years since the onset of the COVID-19 pandemic, but the P&C claims and collision repair industries are still feeling its ripple effects. We've talked about new traffic patterns, driving behaviors, and more, but one curious side effect that's become more pronounced recently is the shift in medical treatment patterns for auto injuries. In the last few years, we've seen noticeable differences around the time it takes to treat an auto injury, the number of procedures associated with an injury, and the costs of treatment. So, this month, we're taking a closer look at what's driving these trends. First, let's talk about treatment. The good news is treatment cycle times and procedure counts have declined. The average number of days from an injured person's first to last day of treatment has decreased since 2019, and the average number of procedures per injured party has also dropped below pre-pandemic benchmarks. Why is this the case? The emphasis on early intervention. Healthcare providers and insurance companies have focused on promoting timely access to care, which includes early diagnosis and treatment, and it appears to be paying off. But what about the costs? The costs and frequency of medical procedures requiring more interventional surgery or radiology procedures has accelerated. Between 2019 and 2022, the average cost of an MRI increased by nearly $200, outpatient surgery by nearly $600, and epidural steroid injections by nearly $1,000. And these same outpatient surgery and radiology procedures are now sought an average of 10 to 15 days earlier than in 2019. There are basically 3 reasons for the cost increases. 1. Impact severity. While traffic patterns have stabilized, driving behavior has not. Collision energy, or delta V, has remained elevated since 2019 as speeding and distracted driving persist. This has contributed to an increase in costly CT scan and evaluation and management procedures. 2. Medical billing inflation. Medical providers are dealing with significant inflation of supplies and labor costs, while frequently locked into pre-pandemic reimbursement rates from their main payers, Medicare and private health insurance. As a result, many medical institutions across the country, especially those in rural areas, are experiencing financial losses, some leading to shuttered services and even closures or acquisitions. 3. Public health. Aging population and rising obesity rates contribute to a larger percentage of pre-existing conditions, such as arthritis, nerve impingement, and herniated discs, which in turn contribute to more billing for outpatient surgeries and injections. ADAS technology and increasing use of telematics may turn the tide of risky driving at some point, but carriers can help ensure accurate indemnity from both a causation and necessity perspective via medical professional reviews and price benchmarking. By leveraging both, insurance carriers can more effectively manage claims costs, identify potential fraud or unnecessary treatments, and maintain accurate and fair indemnity for policyholders. To learn more, visit cccis.com. I'm Eric Bonson. Thanks for watching, and drive safely.